Okay, we'll go ahead and get started. Thank you all for joining us today. My name is Diana Leipold. I'm a manager in the Department of Volunteer Services and Merchandising at MD Anderson. It's an honor to be here with you all today. This past Sunday, June 2nd, was National Cancer Survivors Day, and MD Anderson is hosting a week of activities to honor those who are living with cancer, through cancer, and beyond cancer. I invite you all to participate in the wonderful activities that are taking place this week. I would now like to welcome our fellow participants at the MD Anderson Cancer Centers in League City, Sugar Land, and the Woodlands to today's Lunch and Learn. Today's session is part of a 6-session series that will focus on wellness-related topics and is generously funded by the Department of Volunteer Services and Merchandising gift shop proceeds. Before we begin, I would like to bring your attention that this session is being recorded and will later be available online to view on the My Cancer Connection website. It's now my pleasure to introduce today's MD Anderson expert. Haley Gale is a clinical dietitian at MD Anderson Cancer Center, where she currently works as both an inpatient and outpatient dietitian for hematological cancers. Prior to finding her passion for oncology, Haley worked as a certified strength and conditioning specialist for elite level athletes. In her free time, she travels across the United States in pursuit of new mountains to hike, climb, or snowboard. Today's session will discuss the large amount of herbs and supplements available on the market and how to determine if they are appropriate for your health journey. So please join me in welcoming Haley.
Hey everyone, thank you for being here today. I just want to start with a little bit of a disclaimer. We're going to talk a lot about nutrition as well as herbs and supplements, because I don't think that we can talk about herbs and supplements without talking about the basics of nutrition, as well as that this PowerPoint is really geared toward cancer survivors, so please keep that in mind. If you're undergoing active treatment or you were just diagnosed or anything like that, your recommendations are a little bit different. I do encourage all of you to reach out to your home clinic dietitian if you have specific questions related to your type of cancer or your stage in survivorship. So the first thing we're going to talk about is supplements aren't shortcuts. So, sorry, I'm going to step over here a little bit. Supplements aren't shortcuts. So you can't just take a magic pill and get all your help from that. You really need to eat whole foods, a plant-based diet. So that is the foundation for all of our nutrition, to make sure that you eat a plant-based diet and you're thinking about less processed foods. This doesn't mean that you can't eat any meats. So people get kind of scared when we say plant-based diet, but that really just means that 3/4 of your plate should come from the earth. It also doesn't mean no grains or dairy or anything like that. It just means when you look at your plate, you can see the earth in it. We really want you to limit red or processed meats when it does come to meats. The less you have of those, generally the more clean meats you're typically eating. In processed meats, there are a lot of preservatives, chemicals, things that we know are not good for the body. So the less processed meats you eat, the better your health generally is. That doesn't mean that you can't ever eat bacon or hot dogs. When you do look at those items, try to get nitrate-free bacon, hot dogs, a more natural version of those things. Or there are even kind of like tofu, soy versions of those kinds of products that are a little bit healthier as well. We want you to always include healthy essential fats. So healthy fats come from any kind of fatty fish, which is like salmon, mackerel, halibut, tuna, sardines, trout, as well as nuts and seeds, avocado, and some sort of oils. So making sure that you're incorporating a lot of these healthy fats into your diet, because fats used to get a really bad rap, that fat's not good for you and you need to kind of avoid it or limit it, but fats are a really essential part of your diet. I think now with kind of the keto craze, we're getting away from that and really realizing that fats can be very healthy for you, but not all fats are bad, not all proteins are bad. You just kind of have to pick and choose the ones that are better for you. So like I said, eat more whole foods. The less processed, the better. So it doesn't mean that you can't have potatoes, but you want to eat the less processed version. So obviously a whole sweet potato is better for you than a potato chip. And that has a lot to do with the chemicals and preservatives and all those kinds of things, the added trans fats and things that you get when you get a box or a bag form of something. You want to prepare meals from whole, fresh foods to maximize the nutrition in them, and the less ingredients on the label, the better. So again, less out of a box or a bag. When you flip something over, usually if it has less than 10 ingredients, you're looking pretty good. If something has a list of 50 ingredients, a lot of them are food coloring, all these additives, shelf stabilizers. That's when you kind of start to wonder, how much food am I getting and how much chemicals am I getting? So that's an option you always have to weigh. Another thing to help you kind of avoid a lot of bagged, canned things is to shop the perimeter of the grocery store. So I'm sure you've probably heard that before, and it's not, indefinite, but usually if you stay around the edges of the grocery store, that's where your fresh produce is, that's where your fresh meats are, and it's where your dairy and other less processed items are. Doesn't mean the middle aisles are terrible for you and you have to avoid them at all costs. It just means in general, if most of your cart is filled with fresh produce and fresh meats, that you're doing a little bit better. So these are the three fundamentals for macronutrients that I really like to talk about. Macronutrients are protein, fat, and carbohydrates. Micronutrients are all your vitamins and minerals like vitamin A, E, D, K. But for macronutrients, the big nutrients that actually make up calories are protein, fat, and carbohydrates. For protein, I like to tell everybody this little gimmick: the less legs, the better. So the less legs an animal has, usually the better it is for you. So like cows and pigs have 4 legs. Chicken and turkey only have 2 legs, and fish, eggs, beans, all those plant-based sources of protein have no legs. So the less you eat those 4-legged animals, the better you're typically doing. And that's because 4-legged animals are typically a lot higher in fats, the bad fats, and animals with less legs usually have a little bit more of the better fats for you, the omega-3s found in fatty fish, things like that, nuts, seeds, all those kinds of things. Doesn't mean that we can never eat red meat. Red meat is okay. Less than 18 ounces a week is usually what the American Institute for Cancer Research says. So that's a little over a pound. So you can have red meat, just do it in moderation. We learn a lot about this from the Mediterranean diet. Everybody's probably heard of the Mediterranean diet and how healthy it is for you. They eat a lot of fresh fish, a lot of olives and olive oil, avocado, all those healthy fats. And so that's kind of the foundation that you really want to go off of, eating more seafood and less 4-legged animals. For fats, they are a major calorie source, and that's okay. They have 9 grams or 9 calories per gram compared to fat, or compared to carbohydrates and protein that only have 4 calories per gram. But that's okay. Your calories have to come from somewhere. When you're choosing fats, choose plant-based fats, avocado, olive oil, nuts, seeds. You get plenty of animal-based fats from your meats, so you don't need to seek out animal-based fats like butter and lard and things like that. Again, fats are okay, and they can really protect yourselves and be anti-inflammatory if you're choosing omega-3 based fats and those healthier fats. For carbohydrates, we say brown and close to the ground. That just means when you're choosing some form of a carbohydrate, whether it be rice or bread or pasta or something like that, the browner the better. So brown rice, whole wheat bread, things like that. If you're going to do potatoes, try to do potatoes with the skin on. The more natural form is the better, and this has to do with fiber. So the fiber content in carbohydrates slows down its digestion, and so the slower you digest foods, the longer you stay full, and the less your insulin level will spike. So simple carbohydrates really have no fiber in them, and I'm going to get more into that when we talk about insulin and insulin growth factor in a minute. But just when you're choosing carbohydrates, if you flip over a bag of bread or whole wheat pasta and it says more than 3 grams of fiber per serving, then you're doing good. So looking for more than 3 grams of fiber per serving usually means that it's high fiber. Sorry, there's a typo there. I know it says whole grain instead of whole grain. power. So again, we want to focus on a plant-based diet. How do we do that? I usually tell my patients to aim for 3 colors on their plate at lunch and dinner. And sometimes that's hard. Even if you think about the lunch that you just ate, you know, it had salad in it, maybe you're hitting 2 colors, maybe 3 colors there. And then you start to think about dinner. If you're not eating a salad with every meal, sometimes it gets hard. A lot of times we get hung up on the green foods too. Everybody wants to eat kale and spinach and Brussels sprouts. Those are great for you, but you also need all the other phytochemicals and micronutrients from different types of fruits and vegetables. So you want to be making sure you're getting the red, the orange, the purple, the blue, and there's just a few of those micronutrients that you can find in the different colors. So don't get hung up on the green. I usually try to encourage people to track how many different colored fruits and vegetables they got in a day for like a week, and then just kind of see where you're at. You only ate green and blue 3 days this week. You know, where can you pull in some purple and some orange? So that's really important for you. We want to try for 5 to 9 servings of fruits and vegetables a day. The more, the better. People get really hung up on how much fruit they're eating too. I would say that your biggest diet concern is probably not how much fruit you're eating, and you have other areas that you can work on before you're really strict on how many servings of apples you're having in a week. If you're going to blend or juice foods, that's okay to get more nutrients in, especially if you're not someone that loves a fruit or a vegetable. But we do recommend blending instead of straight juicing, because when you blend, you get all the fiber and you get more nutrients preferred to than just if you juice it straight down. So I can't talk about survivorship or cancer in general without talking about sugar and cancer. So you guys have probably heard at some point during your survivorship, if you work here, if you've been a cancer patient in general, if you've had a family or friend with cancer, that sugar feeds cancer. It's hard to make a blanket statement like that, and you know, it's just simply not true. All of your cells run off of glucose. Everything you eat eventually gets broken down. But what you do want to focus on is something called insulin growth factor and your insulin levels in general. So when you eat simple carbohydrates, so cakes, cookies, juice, something without a lot of fiber in it and a whole lot of sugar, your body responds to eating that much sugar by releasing insulin. Insulin helps lower your blood sugar levels. When insulin is released, we also know that there's something called insulin growth factor released, and this is where the theory behind sugar feeds cancer kind of comes into play. How much the insulin growth factor can affect tumor growth, we're not really sure. There's a lot more research being done on it. We do know that you should avoid foods really, really high in simple sugars. You should not be drinking, 32 ounces of juice in one sitting. And if you eat half of a cake, it's not really great for your body. Those are things that we do know. As far as avoiding all types of carbohydrates indefinitely, that's just not something that you need to do. So this next slide kind of talks more about the effects of the different kinds of high glycemic index versus low glycemic index foods. So in general, you want something low on the glycemic index scale. The higher the fiber, usually the lower the glycemic index. So you really want to keep your blood sugar levels more looking like this all day long. And so when you eat, a really high sugar meal or snack, your blood sugar levels really spike rapidly, releasing a lot of insulin. And then say you go 6 hours without eating and they kind of tank back down. And then the next meal you eat is really high in simple sugars or simple carbs again. So your blood sugar levels are looking more like this. Whereas if you eat small, frequent meals, low in processed foods, high in fiber, your insulin levels look more like this. So in theory, you're releasing less insulin growth factor, and we know those are good things. We know spiking your blood sugar very high several times a day is not good for you. And so that's why a blanket recommendation from pretty much all dietitians is to eat small, frequent meals throughout the day to keep your blood sugar levels stable, and it's also going to make you feel better. Spiking your blood sugar levels really high and letting them tank several times a day is going to make you sleepy. So small, frequent meals will help stabilize those insulin levels. So we're going to get into supplements a little bit. I will say, first and foremost, a word of caution. Supplements are not regulated. It's super hard to regulate them. The FDA has a really tough time pulling supplements from the market, even when they're found to be dangerous. One thing that you can do is you can look for the NSF seal, which is the National Sanitation Foundation. So this seal tells us that it was third-party tested, that what's in the supplement is actually what they're saying is in it, and that, you know, somebody else has kind of looked into this a little bit more. It does not test for efficacy or whether or not the supplement does what it says it does. So if the supplement says this will lower your blood pressure because it has this much of a certain supplement in it, they don't test for that. They just say, yes, this does have 40 grams of ginkgo in it. So just taking a further look into that, making sure that all your supplements are third-party tested, you're not ordering things off the internet that you don't really know where they come from. So green tea is one that gets kind of a lot of hype, especially, you know, on the internet and in certain Asian and Chinese cultures. Green tea is really great for you unless you're on certain chemo medications. Again, I won't talk about that too much, but there are definitely certain medications when you're undergoing chemotherapy that you're not allowed to have green tea, mainly blood cancers. So if you're on active treatment, please talk to your doctor about things that you should avoid on these chemotherapy treatments. So throughout these slides, there are a little bit of research that I've kind of popped in here and there. All of this research comes from a website called UpToDate. UpToDate is a really good place that you yourself look at certain supplements and kind of look into the research of what's been going on with these supplements. It's all peer-reviewed, which means that they ran these tests and these research studies, and then a bunch of colleagues looked at it and said, yes, this research was ran with good procedures, and this is a valid study. And so that's something you really need to look at, these claims. A lot of times people will come to us as dietitians, well, I read this one research study, and we look at the research study, and it only had 7 people in it. You know, that's not a very good size of a population. So when you're thinking about trying a new, different supplement, please make sure that you understand the research behind the supplement. I brought these books because this is a whole book on every different type of herb and supplement. Even as dietitians, we don't know them all. I can't tell you about every different herb and supplement and how it affects your cancer treatment. I can tell you about some of the major ones, but at the end of the day, if you're really set on taking an herb or supplement, you really need to look into it yourself. And again, herbs and supplements aren't really the big picture. You should really focus on cleaning up your diet first. So green tea is high in polyphenols. We know that's really good for inhibiting cancer growth. And then there's a little bit of research that if it was consumed in large amounts, that it improved the survival rate of ovarian cancer. So that's really good. So green tea is one of those things, especially as a survivor. We know it's high in antioxidants. Drinking a cup or 2 of it a day, it has a little bit of caffeine into it. So it'll help you with mental alertness as well. Flaxseed. So flaxseed provides ligands, which is a polyphenol, which is also an antioxidant. Fiber, which we talked about, is really good for you in your digestive system. And omega-3s, which help protect your bones and joints. It also has a weak estrogenic effect, which can help with tamoxifen activity, which is a breast cancer drug. So there is some research to say that flaxseed can enhance the effects of tamoxifen. If you eat too much of it, especially in the raw form, it can cause a little bit of gastric upset, gas, bloating, diarrhea, and it's contradicted in any kind of irritable bowel disease, UC, Crohn's disease, anything like that, because the little seeds can kind of irritate your GI tract. Consuming 25 grams of flaxseed daily was shown to may reduce tumor growth in breast cancers. And again, all this research is from UpToDate. And so you want to always choose the food source, obviously, and ground flaxseed is probably a little bit better than just the raw flaxseed because your digestive system has a hard time breaking it down. So you really want to grind it up because otherwise it goes through as kind of fiber and it'll come out in your feces. So if you grind it up, then your body can digest it a little bit better. So it's great when you sprinkle those flax seeds on your salad. You're getting a lot of fiber from it, but how much is being absorbed probably very little. Turmeric. Again, I can't talk about cancer survivorship without talking about turmeric. Most of our patients have heard about this at some time or another. A word of caution, you don't need to take anything in excess. You don't need to be taking 7 turmeric capsules a day. The best type of supplement is one that you cook with. Turmeric is definitely one of those because it's heat activated and it's fat soluble, so you need to eat it with a fat containing food and it's better absorbed. Black pepper also helps turmeric be absorbed better. So cooking with turmeric or cumin can really be better absorbed if you're doing black pepper, you're heating it, and it's with a fat soluble or a fat. We know it's anti-inflammatory. That's great. Cancer is all about inflammation. Preventing cancer is all about, being less inflamed in your body. It's an anticoagulant. Also, it inhibits angiogenesis. So angiogenesis is when the tumor starts to kind of grow and form new blood vessels. And so we know that it inhibits that. So it may have an effect on how fast your tumor grows. Again, if you're in survivorship, that's not as big of a deal. If you're not in survivorship, again, we don't want you taking like 7 capsules of this. Cook with it. You can make turmeric teas, that's okay, but everything in moderation. Again, the bioavailability is low, so just making sure that when you are using it, you're activating it in every way you know how. And currently, evidence does not support, there is no great standing evidence that says we take all this turmeric and our cancer stops growing. It's just there's some promising research going on there, and we know a little bit of it. It definitely isn't going to hurt, and it may help. Fish oil. So omega-3s are one of my favorite kinds of supplements. Omega-3s do not have to come from fish oil, but usually when you get an omega-3 supplement, it is some form of fish oil. Omega-3s are anti-inflammatory. They help protect your bones, joints, and your cardiovascular system. They can lower your heart rate. And so if you're on a blood thinner, maybe a lot of fish oil is probably not the best thing for you because you're already thinning your blood, and fish oil or omega-3s can kind of thin that more. Fish oil specifically because it has vitamin E in it too. So you kind of have to know what medications you're on and whether these are appropriate for you. Again, look into anything that you're going to take. When you are taking a fish oil, if you're just a normal, healthy person in survivorship, you really want to look for the EPA and the DHA content. So those are really the very good anti-inflammatory markers in fish oil. So a lot of times you can pick up a fish oil off the market, salmon oil or something like that, and it says 2,000 grams of fish oil, and you flip it over and the EPA, the DHA content is very low. It's like 300 milligrams. So you really want the EPA and DHA to be closer to 1 to 3 grams. And that's a safe dose for somebody to take daily. And so if you're looking at taking a fish oil, I take a fish oil daily. Doesn't necessarily mean that you have to. If you're eating a lot of omega-3 containing foods, chia seed, flaxseed, salmon, you don't have a lot of bone or joint problems, maybe you don't need to take it. But if you are taking it, make sure that you're getting one that's NSF certified and that you're looking for that EPA, DHA content. Again, you want to be careful with where the fish come from. So if you're getting fish that were, farm-raised fish and they're squeezing all the fish oil out of them, what kind of water was that fish swimming in? Did it contain mercury? So that's why you really want to make sure you get a good brand of fish oil. It's probably going to be a little bit more expensive. That'll be your key. Again, NSF website will help you pick out those ones that are a little bit better. Mushrooms. So mushrooms are one of those things that you can pretty much safely incorporate into your diet with no issues. Reiki, sorry, Stephanie. So there's some good research behind mushrooms that they're anti-inflammatory, they can boost immune response, and they may inhibit cancer cell growth and invasion. So again, the research is not definite, it's a maybe, but it's definitely not going to hurt you to incorporate more regular mushrooms into your diet. Do you need to be taking dehydrated mushroom capsules? Absolutely not, but cooking with them in a healthy way, definitely a plus. Reishi and shiitake are some of the 2 most researched mushrooms for you to take or to use, and you can put them in soups or sauces. They have really good qualities. Reishi is high in ganodoric acid, sorry, I probably butchered that, which can help reduce cholesterol and lower high blood pressure. Shiitake, which is pretty easy to find. You can find shiitake mushrooms in most grocery stores. Excellent source of vitamin D. They can reduce inflammation, according to some studies. And then I listed off some other mushrooms that are good for you. Again, usually the white mushrooms found in the grocery store don't have that many good properties. You have to find the weird, funky fungi mushrooms. So start looking a little bit harder for some of those shiitake or reishi mushrooms and see if you can find them. Melatonin. So again, I think this is another really safe supplement that you see a lot of people take to help them with sleep. It is a naturally occurring chemical in the body. So what happens when you go, or it's about bedtime and you start shutting down all the lights and it starts getting dark outside, your body naturally starts to make melatonin, which makes you sleepy. So as a population, we're watching TV until right before we go to bed, or we're on our phones, and there's a lot of this blue light that keeps us awake. And so melatonin can, if you take it orally, can kind of help correct some of that. Really, the best thing you want to do is stop staring at a screen 30 minutes before you go to sleep. But melatonin can also help if you're jet lagged or you're having issues with your sleep cycle in general. We use it in our elderly population here for a couple research studies to help them sleep a little bit better when they're going through cancer treatment. Again, it's a very natural thing. About 0.5 milligram for insomnia or jet lag before you go to bed is good, but there's also food sources. Again, I would love for all of you to take less pills and eat more food sources of things. One of the greatest concentrations of melatonin is found in tart cherry juice. It is not regular cherry juice, so you have to get the tart version specifically. But if you drink about 8 ounces of that before bed, it's shown to really improve sleep and raise those melatonin levels. It's also a high antioxidant containing drink, which can help with inflammation. So if you like cherry juice, try tart cherry juice. It is very sour. It's a lot lower in sugar than like the normal kids juices, but give it a try, see if you like it. Other plants that contain melatonin: tomatoes, grapes, the skin of grapes more specifically, and walnuts. Iron. So this is a really big, busy slide on iron, because a lot of our patients, when they're going through treatment or after they're done with treatment, they still have low hemoglobin, and a lot of times they're asking us, how can we raise this level? Can I take an iron supplement? I know that iron has something to do with hemoglobin. So in general, unless you are proven to have iron deficiency anemia, there are several different types of anemias. Iron will not help you. Most of our cancer patients have something called anemia of chronic disease or of inflammation. Supplementing with iron in that case will not improve your anemia. So just keep that in mind. For a normal person, you can take a daily multivitamin with your daily dose of iron. And that's okay, but you are at risk for something called iron overload if you supplement when you don't need it, especially your patients that have had a lot of blood transfusions, even in the past, even as a survivor. If you had multiple blood transfusions, your body has stored all that excess iron. You still may have low hemoglobin, low hematocrit, low red blood cells. Supplementing with iron will not bring that up. Your iron stores are okay. It has more to do with inflammation and the kind of cancer treatment that we gave you. So just keep all that in mind. Also, food sources of iron. If you cook with a cast iron skillet, that will help you bring up your iron levels. And if you pair it with vitamin C, orange juice, lemon juice, that also helps enhance the absorption of iron. Naturally occurring iron in foods is like meats, and then dark leafy greens have iron, and then some fortified grains, mainly meats, and then dark leafy greens. But if you cook in a cast iron skillet, if you're a vegetarian or a vegan, and you put some lemon juice or orange juice in it, it can really help you absorb it. Or tomato sauce. A lot of times people do pastas in a cast iron, and that helps. Probiotics. Another one of my favorite kind of topics to talk about. So there's a lot of different probiotics out there. You've probably heard of like Align, VSL number 3, any of those traditional Culturelle, some of those things that you can find over the counter and or your doctor may have mentioned to you. Really, we want you to get it from food. Food is the best source for probiotics. And probiotics are alive. That's kind of what the main thing behind probiotics is that they're a live microorganism, and they exhibit some sort of health benefit on your GI tract or your body. The main sources of probiotics are kombucha, which is a fermented tea, which is that picture up there. Sauerkraut, actually the king of probiotics. Sauerkraut has more colony-forming units, or CFUs, per ounce than any other kind of food source of probiotics. So if you like sauerkraut, the good fermented kind, kimchi, which is just Asian sauerkraut. So those are our kefir. Kefir is also a really good one you can find in the grocery store in this bottle. It's like a drinkable yogurt. And I will briefly touch on yogurt. Yogurt does have some source of live microorganisms in it, but it does not have enough to be considered a probiotic food. Does that mean that you shouldn't eat yogurt? No. Yogurt still has some sort of those healthy live cultures that are good for your GI tract. It just does not have enough of them for us to declare it a probiotic food. Kefir, on the other hand, which is just a drinkable yogurt you can put in smoothies or add to things, it does have enough of those. So what do probiotics do? So there's a difference between prebiotics and probiotics. So prebiotics are the food that feeds probiotics. Probiotics are live active cultures that deposit in your gut in a healthy way. So your gut has all this good, healthy gut bacteria that helps you digest food. It's a large part of your immune system. And when you eat probiotics, it contributes to that good, what we call gut flora. And then when you eat fresh fruits and vegetables, anything high in fiber that is slow going through your digestive tract, that good gut bacteria has time to feed on that fiber and all those fresh fruits and vegetables. So prebiotics, food for the probiotics. So that's how you kind of know the difference. I know a lot of people get confused sometimes. And so with some of the IBD diseases, probiotics have a lot of good results with kind of helping reestablish that. Now, when probiotics are not good is in someone that really hasn't eaten for a long time. So hopefully that's none of you. But if there's a patient that hasn't eaten for a really long time and they're what we call immunocompromised, or your white blood cells and your ANC are low, probiotics can kind of not deposit in the gut and deposit in other places, and that's called translocation of bacteria. So if at some point during your treatment your doctor said no probiotics, it's for that reason. You are probably what we call neutropenic, immunocompromised, and you're at risk for depositing in other places. And a normal, healthy human being that's eating regularly, it's going to stick right in your gut, right where it's supposed to be, and do the job that it does. So the last thing I kind of want to touch on, I added this slide afterwards, and I guess I forgot to put it in, is organic versus non-organic. So there is a list put out by the environmental working group called the Clean 15 and the Dirty Dozen. And so those are foods that if they're clean, they're okay to eat non-organic, and if they're dirty, you really want to make sure you're getting organic or really washing them very well. So with a nice vinegar water or a hard scrub. The environmental working group comes out with this list every year, and it's based on what kind of field they were grown in and how many chemicals have been put into the ground and the soil of that field every year, and it's also based on how much pesticides are sprayed on the plant itself. Organic does not mean that no pesticides were used. It just means that healthier pesticides that are deemed more safe were used. So make sure you remember that. Even if you're getting organic strawberries, you still need to wash them. They still have some kind of weird stuff that may taste bad, and plus dirt. You also need to remember other people handle those items too. So eating an apple that 17 people have touched from the grocery store is probably not a good idea. If you or a family member or somebody is neutropenic or immunocompromised from therapy, it's okay to eat fresh fruits and vegetables, especially those with thick skins on them. Peel the skin off. Make sure you're washing everything really well. Things that harbor more bacteria are like berries and lettuces. They need to be triple washed. You may want to stay away from berries if you're immunocompromised. But as a normal, healthy adult, just watch out for those blasts that says that there was E. coli found in romaine or peanut butter. Other than that, just take care of yourself. Choose organic when you can. If organic is too expensive for you, definitely avoid it on the foods that have a thick peel, because bananas did not get sprayed with pesticides. So how important is it for a banana to be organic? Same thing with watermelon or avocado. So just think about those things. If you're eating the skin of something, it's probably a little bit more beneficial to go organic. If you can't, wash it really well. Okay? So I think at this time we're going to take questions.
Thank you, Haley. That was really insightful. We're going to go ahead and open up the floor for questions. As a reminder, for those that are watching remotely, if you have questions, you can email them to mycancerconnection@mdanderson.org, and we'll work to get those answered. We'll also check in with the Houston area locations to see if they have any questions. And as you ask questions in the room, please remember to use your microphone button, and you need to hold it down the entire time you ask your question. That's the only way that our friends at the Houston area locations are going to hear as well. So we'll go ahead and open up. Does anyone have any questions? Okay, we'll start here. And if you can just hold your microphone button down right there. Yeah, you just push the... I'll come to you. Yeah.
So I was advised, I'm a 3-time cancer survivor, so I was advised to buy some grapeseed oil, and you didn't touch on that. And I bought it. I don't like the taste of it, but it did make me feel better. So I wanted to get some insight professionally from you, from just a friend that influenced me to get it at the vitamin store. Thank you.
I'm going to be real honest. I don't know a lot about grapeseed oil. I know that it's considered a high-dose antioxidant. It is not a supplement that I hear a lot about, and you really need to be careful with what research was given to you to say that grapeseed oil is going to do anything special for you. Up to date, we'll have some good research on it. It may not be harmful, but is it helpful? So you kind of need to look into that. Again, like I said, I brought all these books, and I can't go over every supplement, and dietitians are not food dictionaries. We don't know every supplement. Like I said, I used to be a sports dietitian, and there, oh my gosh, they will bring you every supplement known to man. We can't know about every supplement, but I will tell you the food source of everything is always better. And if you're interested in a supplement, look at research-based articles and see what they say.
It tastes a lot like fish oil.
Okay. I don't think it has omegas, but I could be wrong.
Okay, thank you.
Go ahead.
I've been told by the nutritionist that I could have less than 1 glass of wine a week, which I thought was pretty minimal. And then I've told by my oncologist I could have, a glass of wine a day. So I've kind of gotten conflicting information, and I'm wondering what you think.
So we go off what is called the American Institute for Cancer Research recommendations, which actually recommends no alcohol during treatment. So she was probably being a little bit relaxed. So this is what I tell my patients. And again, your home dietitian knows more about what treatment you're on, what kind of cancer you have after treatment. Mental and physical health is really, really important, right? Is it better for your mental health for you to be able to have a couple glasses of wine with your friends a couple times a week? I'm all for it, and obviously if your doctor thinks it okay, it's probably okay. I would probably say, as me as a dietitian, I would say you're okay with 2 glasses, but that is my professional opinion, and it's okay for people to have different professional opinions on things.
When you talk about flax seeds, you mentioned IBD. What's IBD?
Oh, sorry, irritable bowel disease. So any kind of inflammation in your gut, or you've been told you have Crohn's or ulcerative colitis, you just have a lot of GI upset, things like that. If a doctor has ever told you have irritable bowel disease, I'm sorry, I should have not put that abbreviation in.
Also, what's your opinion on prebiotics?
Prebiotics, I kind of went over it briefly. Prebiotics are just usually fresh fruits and vegetables or anything with a lot of fiber that's slow through your digestive tract that can feed the good, healthy gut bacteria. Or if you're taking a pill form, I would look. It's probably some kind of what we call psyllium, which is a soluble fiber that sits in your GI tract longer. So you just really need to read if it's a pill form and see what's in it. Prebiotics are usually okay, but again, you can get it from food. Eat a banana. Go ahead.
What's your opinion on two things, the quercetin supplement and the Budwig diet?
The Budwig diet. So, tell me the supplement name again.
Quercetin.
Yeah, defer. I don't know a lot about it. I don't research into supplements that much because, again, my philosophy is a plant-based diet. Those supplements that I did go over are the ones that have a lot more research behind them. The Budwig diet. It's one of those fad cancer diets that people get on. As dietitians, we learn a lot about these fad cancer diets and books that are written by doctors even. In general, a lot of these are not research-based, or they have one small study done. You really need to look for the research that has big meta-analysis behind it, which means they looked at several different research studies, compiled the information, and then made a conclusion about it. These cancer diets come and go. They all do. It's paleo, it's Whole30, it's the Budwig diet, it's keto, it's all of those kinds of things, and it's really just not research-based, so you need to be careful. Really, the best diet for you is a plant-based diet, low in chemicals, low in processed foods. It's not sexy, and that's what everybody wants. They want this sexy diet or this supplement that's going to cure their cancer, that is going to prevent you from getting cancer, and that's just not the answer. If it was, my job would be a whole lot more important than your oncologist, but that's just not how it works. So just keep that in mind when someone is pushing some kind of weird fad cancer diet on you, that it's most likely not research-based, and we do see patients that get very malnourished on these weird cancer diets. They're eating no protein because somebody told them all protein is bad for them, when it's the exact opposite. Please make sure you talk to a registered dietitian, not a nutritionist, somebody with the letters RD or RDN behind their name that has an advanced degree and an internship, a year-long internship looking at different types of illnesses behind their name.
Just a quick follow-on. The list of all these supplements that you talked about, is it safe to take everything in one go together? Forget getting it from food, but the supplements.
So your body only has a maximum absorption capacity, right? So you need 80 grams of protein in a day, depending on how big you are or whatever. You can't eat all 80 grams at once because your body doesn't have the ability to absorb it all at once. I would say taking a handful of pills, of all the pills you needed in one day at one time, one, it's probably going to make you nauseous. Two, I don't know if your body has the ability to absorb all these things at once. Three, you also need to look at what type of supplements you're taking and the percentage of daily value of vitamins they have. So patients will come to me sometimes with 10 different supplements, and I look, and 3 of them contain 1,000% of your daily vitamin C. Your body does not know what to do with high dose antioxidants like that. You can drink too much water and flood your brain. You can have too much of a good thing. And that's typically what happens is everybody goes into panic mode and they start taking all these supplements they heard were good for them, and you're getting way too much of a certain nutrient or supplement. Everything in moderation. That's why we say food first. Go ahead.
I'm not sure if you covered this, but if I were interested in, I make smoothies, and a friend sent me a plant-powered protein. I don't eat meat. It's this Ollie smoothie, plant-powered protein. Is that something that you would recommend, or a plant-powered protein to have with the smoothies?
Absolutely. You always want to do some sort of protein with every meal and snack. So, anywhere from like 10 to 20 grams of protein in your morning smoothie. You definitely don't want it to just be fruit juice and vegetables. You want a little bit of fat. You want a little bit of protein in there. You want every smoothie or something like that to have a little bit of protein in it, whether it comes from yogurt or a plant-based protein. That's perfectly okay.
Okay, and then if you mentioned yogurt, if someone has yogurt, puts yogurt in the smoothie, would that be in lieu of or in addition to?
It depends on how much yogurt you put in. So 1 cup of yogurt, depending on the brand, if it's Greek yogurt, has about 10 to 15 grams of protein in it. For a lady your size, I'm just eyeballing you, 15 grams of protein in your morning smoothie is probably enough, depending on how much other protein you get out throughout the day. Your body only has the ability to absorb, and I'm going to get real technical right here, 0.4 grams per kilogram roughly at one time of protein, okay? So if you put 40 grams of protein in your morning smoothie, congratulations, you're going to excrete a lot of it out. And so sometimes people, the bigger you are, the more you can absorb at once, right? But do you, need a 40-gram protein shake in the morning? No, it's probably a lot for you. So 15 grams is probably enough for you if you're putting a whole cup of Greek yogurt. If you want a little bit of more, it's not going to hurt you. But it's probably okay with just the yogurt.
And one final thing, I think I saw where you had the link to view your session online. Mm-hmm. I didn't write it down. Can you show that again?
Yes, sir. Sorry.
Little controversial subject, but you're talking about plant-based things. What about the hemp plant?
Okay.
And you know what I'm leading to is cannabis.
Yeah, cannabis is not legal in Texas. So I'm going to leave that at that. Cannabis is not legal in Texas. If you're in a state where it is legal, talk to a medical provider there, and that is all the opinion that I'm going to give on that.
Is CBD not?
CBD does not count. So CBD does not have THC or the component that makes marijuana, essentially marijuana. I have heard some really great things about CBD, but you need to be careful because it is a new and emerging substance. It is a substance, and there's still a lot of research coming out on it. Do we exactly know what it does? Not yet. So that is your own journey. There's not a lot of research yet on it yet. Sorry. Go ahead.
Is there any particular vitamin that you recommend as a daily?
A women's one a day. Just a basic natural vitamin. Don't get caught up in all these like personalized, specialized vitamins, just like a basic women's one a day over the counter. Look for that NSF symbol. Chewable is usually better absorbed. So yeah, because you chew it and it helps your gut break it down a little bit more. Go ahead, sorry.
How do you recommend that you wash your vegetables in?
So most people say like a little bit of hot water and a good scrub. If you want to be extra careful, put in some vinegar water. I would not buy those expensive vegetable sprays. Just buy some vinegar. It's like 98 cents for a giant thing of it. Put it in a water bottle and wash it off. Not anymore. Go ahead.
It's not cheap anymore.
Can you explain a bit more about juicing and why you mentioned that blending is better than juicing fruits and vegetables?
So you get the fiber when you blend it, right? So you just kind of mush it all up like you chewed it, right? And then you can drink it through a straw. If you just straight juice it, depending if it's a fruit, you're just getting the sugar and some vitamins from it, right? And again, we don't want to just do a bunch of sugar. As adults, we don't need to be drinking a lot of juice. You don't need 32 ounces of juice, 8 ounces of juice with breakfast. If you want a little bit of orange juice, that's okay. Sometimes after you work out or you're feeling a little lightheaded, orange juice is good for you. But in general, we don't need to be just drinking a bunch of juice. There are juices that I think are more beneficial than others. I think beet juice is a really great juice if you want to drink a little bit of that. Tart cherry juice. But as far as like regular apple juice, something like that, I'd rather you blend the whole apple and do blenderized than straight juicing.
The lady in the blue, I think you had your hand up for
Blue?
I'm a little confused about the flaxseed issue because it says on the notes there that it has some slight estrogenic activity. And so I was always under the impression if you're estrogen receptive, then that is not a good thing.
It does depend on the type of breast cancer that you had, too. And
estrogen receptive, then stay away from flaxseed?
Claire, do you want to enlighten her? Sorry, Claire is our breast dietitian. Again, all of our services are a little bit more specialized. Claire helped me put together this PowerPoint. Sorry, I don't want to call you out. There is limited research on how estrogen affects estrogen-positive breast cancer, and so that is. It's hard to tell whether if you eat a bunch of estrogen-containing foods. Usually most doctors do tell you to avoid really high amounts of soy or any estrogen-containing foods. We would think that if you have estrogen-positive breast cancer that you would want to avoid really high amounts of estrogen. She's got it. Thank you, Claire. Go ahead.
Salt peptide is a substance that's under a lot of study.
Mm-hmm.
And most of the salt palmetto is not really salt palmetto.
Mm-hmm.
There's only about 10% that's marketed as such.
Mm-hmm.
How do you deal with situations like that?
And look for that seal, look on that website, and see what they say about it, okay? Because if I knew every supplement on the market, that would be my whole job, probably 10 people's whole jobs. That's why I said look for that seal, okay? Yeah, so I just brought these as examples. If you want to take a look at them on your way out. This is called Herbs at a Glance. This is from the National Cancer Complementary Medicine Foundation. This is just a giant book that I mainly brought as like an example of how I cannot tell you about every supplement. You know, I can't tell you about the 4,000 different things in here. You know, some of this is up to you and your health journey to be your own advocate. I can tell you about the ones that I know have a lot of research behind them, but if I knew every supplement, you know, I would be an anomaly. There's also another good book called the Clinical Guide to Herbs. It's a little out of date, but you know, it has some good information in it. Look into these things yourself. Again, I could only post about 10 different things that I know are pretty safe and pretty okay and are probably not going to affect you too much if you eat them or drink them in excess. But again, I'm not a Chinese herbal medicine doctor. I'm not a naturopath. I'm not the greatest expert ever on herbs. These are just some that are safe from you and we know have benefits to them.
We'll do one last question. Yeah.
Hi.
On behalf of my mom and also a couple of our friends of mine, as far as sugar, what are some of, I know you touched on these, what are some of the safer fruits and vegetables to not overload? Once again, keeping in mind that balance in everything, you know, you don't want to have 4 bananas. As far as foods on the glycemic index, what are safer fruits and vegetables?
So, fruits that are higher in sugar, bananas, mangoes, grapes. So we know that those are a little bit higher in sugar. Foods that are lower are fruits that are lower in sugar are like berries. They're typically a little bit lower than sugar. Non-technical fruit items like tomatoes, avocados, and then you have your ones in the middle. I would not get so hung up on the glycemic index that you're avoiding any certain fruit in excess, okay? If your mother or friend likes pineapple with their cottage cheese, that's okay. If you're pre-diabetic, you know, that's, like I said, that's a whole different story. You know, you need to be careful with sugars, but that is a specific subset of a disorder, and this is more like blanket nutrition. Diabetics should limit the amount of simple sugars that they eat in general. Okay. Is that it? I want to thank Claire over there, she helped put a couple of slides together for me, and then this whole PowerPoint, it kind of gets passed around. You may have seen a couple slides here and there. Some of the other dietitians have helped us work on it. So thanks so much for being here. If you have any more questions, I'm down here, and I also have cards up at the front.
Thank you, Haley. Thank you for sharing your experience with us. Just